everyone here covering this, and as well as to all of my fellow Mississippians. As we have said now since late July, early August, Mississippi has been improving, but we have also been saying that the threat is not gone. We saw numbers today that do not fit the downward trend in COVID-19 cases, and it is a reminder that nothing is inevitable. Our actions as a people dictate the results. I'm a numbers guy, not a narrative guy. I've always said that I'll tell you when the numbers are good, and I'll tell you when the numbers are bad. Numbers had been very, very good. Today, they're not so good. In fact, they're bad. Admittedly, it's just one day. It's not a trend, but it is important to notice it and to acknowledge it. And we'll talk a little bit about potentially what's causing it. Please continue to do those things that we know have an impact. Mask work. The numbers from the last few weeks bear that out. Please continue to avoid unnecessary social gatherings. Parties cause spread nearly every time. Ignoring the rules, not paying attention to our suggestions, and in many instances, our executive orders to wear a mask, to stay socially distanced, matters. The worst thing we can do right now is let our guard down. As I have said repeatedly, over the last 3 weeks, we have basically cut our numbers in half. The decision we have to make today and yesterday and tomorrow is, are we going to step on it? Are we going to try to cut it in half again? Or are we going to let our guard down? Or are we going to let the downward trend plateau here and then perhaps even turn around? And that is not what we need to do. If we want to keep our kids in school, if we want to keep our colleges open, if we want to have an opportunity to have college football, we have to remain vigilant. We have to take the community spread that we have today and continue to reduce it, to keep that R naught below 1, to continue to see numbers coming down. Again, we're certainly not going to panic based upon today's number. Over 1,300 cases today. As I told you yesterday, our 7-day average as of yesterday was right at 700. Now, Wednesdays are typically larger than other days. We know that. We've seen that throughout this pandemic. But we have to be aware of the data. We have to pay attention. We have to stay strong. We have to protect our neighbors. We have to protect our family. We can come together and do this. In fact, over the last 6 weeks, we have been doing it. But we've got to keep driving things down. We got to keep using our head. We got to realize that if we do the little things now, it will have an impact 2 weeks, 3 weeks, 4 weeks out. So I want to encourage all of my fellow Mississippians to continue down that path. At this time, I'm going to ask Dr. Dobbs to give us an update on the numbers.
Thank you very much, Governor. Today we're reporting 1,348 new cases of coronavirus, a considerable increase over what we saw a couple days ago, but I would like to remind everyone to understand that there will be variability, and we do see a little bit of a lag after the weekends and then sort of resetting in the middle of the week. We will have to follow it over some days to see what kind of trend we're going to see, but still unwelcome news nonetheless. And if we look at the number of deaths, we have 31 new deaths among Mississippians. And we need to realize that these are people who did not have to die. These are people who otherwise would be with us today. Most of the people who are dying today in Mississippi are not in nursing homes. They're people who live in the community. They're contracting COVID and they're getting sick and they're dying. So it's something we really need to work diligently to suppress in the community so that it doesn't reach people vulnerable and healthy, some of whom are going to sadly die. If we look at what's going on in the school situation, if we look at the cases that were reported in the last week from August 10th to August 14th, we reported 84 additional teachers who who are diagnosed with coronavirus, an additional 132 students with a number of total students quarantined last week of 1,970, and teachers and staff 328. So we still have a lot of headwinds as far as kids coming into school with coronavirus, but I would like to commend our school systems for jumping on this. This high number is an indication of the seriousness with which they're taking it, and if we're going to have a successful in-person, next month or so, it's going to take this sort of aggressive isolation and quarantine approach as well as the preventive measures to make sure that we can successfully get through the school year. Some schools will have to close temporarily. It's inevitable, so just be prepared for that. The other thing is I would like to mention that teacher testing is available. If you go to our website or to the UMC website, teachers can sign up for free testing. Right now, it's only going to be at the existing rotational sites and the West Street, but starting Monday, we'll have our teams in all the county health departments on that rotation, and so stay tuned. That'll be available starting next Monday. If we're talking about colleges, we're extremely concerned about colleges. We've seen certainly across the country a lot of situations where people have actually had to close college right after they opened it. Certainly that's not something that we want to see. We are investigating 2 outbreaks, one at Ole Miss and one at Mississippi University for Women. The one at the W has some traceback to the Cotton District in Starkville. Not a big surprise, right? We know when people socialize and get in groups concentrated, not wearing masks, they're absolutely going to spread coronavirus. So we will continue to investigate more, so expect more information as we go forward on that front. And Governor, that's all I have today.
Thank you, Dr. Dobbs. Just as a reminder, I know Erica, I believe, had asked a couple of days ago about the data from the White House. I believe we got her that information. We did do a call with the White House Coronavirus Task Force yesterday. It was very focused on long-term care facilities and the need and the desire and what's ultimately going to be the requirement for weekly testing of nursing home employees. That's being driven by the CMS, and obviously they're going to be receiving rapid tests being distributed over the next 6 weeks or so. That is certainly an effort that we support. We are going to continue to monitor that and support that as well. But as I mentioned 3 weeks ago, our total number of cases over the 7-day period, and that's Saturday to Friday, is the data that they look at, was 9,100. 2 weeks ago, that number was 6,700. Last week, that number was 5,496 cases over that 7-day period. That showed Mississippi having approximately 185 cases per 100,000 residents. That compared to the number of 171 in our FEMA HHS region, obviously slightly higher, but not significantly so. With respect to test positivity, which has obviously been a topic that is of interest certainly to some in the national media, our test positivity for that 7-day period was 12.4%. That was in comparison to our FEMA HHS regional average of 11.0. So again, test positivity a little bit higher than the region, but not a lot. There's a lot of factors that go into that, a lot of reasons. One of the things that we'll see is our testing numbers in large part are driven by demand. So as people feel better and they're not going to get testing comes down because we're not seeing mandatory testing in a lot of facilities throughout our state. Many of our tests, in fact, a majority of our tests are done at private labs. And if individuals are not feeling sick, they're not going to their local doctor, they're not getting tested. Obviously, the state health lab is doing a lot of random tests. They did it in Holmes County. They're doing it, I think, I don't know if you've announced this, but in Choctaw in the next couple of days. And so they're doing significant testing out in the communities. But again, total testing numbers are driven as much by demand as anything else. So our numbers are 12.4%, still too high, but also headed in the right direction slowly but surely. As I mentioned yesterday, that number of total positives on a 7-day average had come down to about 700. We had approximately 4,900 total positive cases in the previous 7 days through yesterday. With today's number, last Wednesday was the largest total number of positive tests that were reported in any given day for almost a 14-day period. That was just under 1,100, so today's 1,300 plus is actually up week over the same day. Those additional 200 cases are going to put us back over approximately 5,000 over a 7-day period, which is certainly not the direction we want to go, but it is one day. But it is important to note that the things that we're doing today are going to have an impact on positive tests 2 weeks from now and 4 weeks from now. So let's continue to stay vigilant. Let's continue to work. With that, I'm going to turn it over to our Director Michelle of Mississippi Emergency Management Agency, who wants to talk a little bit, I think, looking at the maps, the fact that we are in hurricane season and there are numerous storms east of Florida.
Yes, sir. Thank you, Governor. Good afternoon, everyone. Yes, unfortunately, we do have a storm update to give everyone. But first, let me give you a quick update on the COVID Emergency Relief Fund. As of today, we have received 693 applications for the Emergency Relief Fund. Of those number of applications, we've only received about 26 projects. Now, what that means is we've got a number of applications that have come in, then we have validated applications as far as the applicant itself, but as far as actual work projects, we've only gotten about 26. The good news is we've gotten about $8 million worth of projects just over the last 24 hours, so we're starting to see the counties push those projects in. So I want to encourage the counties and municipalities to do that. We are rapidly approaching our October 15th deadline for submission, so it's very important that you do that to give us the opportunity to wrap everything up before we transfer funds over or to the governor. One of the things that we talked about last week with the Association Supervisor, we'll be talking with them again tomorrow, is about payroll expense for public health and public safety. A lot of information out there that's going to be a big one if counties and municipalities take advantage of that and do that right and quantify that information accurately. That's going to be a big ticket item for counties and municipalities to be able to take advantage of. And we'll be talking about that more tomorrow. So, tropical update. We're currently watching 3 systems that are moving across and into the Caribbean basin. Only 2 of those thus far have been named. The first one is Invest 97 Lima. That one has a more southerly track, and right now it's tracking and is projected to, if it continues along the same modeling track, and things are still very iffy on that, we could see potential landfall of that somewhere along the Gulf Coast line, whether it be Louisiana, Mississippi, Alabama, or even Florida, in the next 5-7 days. The second system out there is 98 Lima, Invest 98 Lima. It is tracking a little bit more to the north. You're looking at about another 7 to 10 days. It would be just right behind this system if it were to make landfall and come in the Gulf of Mexico. Again, the spaghetti models on both these systems are still very iffy, and the intensity models that we're looking at right now are showing them as low risk. But let me just reiterate to everyone, once these storms enter the Gulf of Mexico, they become very unpredictable. So these storms could intensify very quickly. So out there, as you're watching these storms, pay close attention, continue to be prepared to evacuate if necessary. And then finally, that third system that's out there is still just a tropical wave coming off the coast of Africa. It's still very undeveloped, so we'll continue to watch that one along the way. So keeping our eyes tuned, Governor.